This week, doctors from around South Florida's busiest hospitals literally pleaded for the still unvaccinated to change their minds and get those COVID shots. And at the same time, we learned almost half the staff at Miami-Dade's Jackson Health System is among those unvaccinated. Right now, we have a chance to talk to the CEO of Jackson Health System. Carlos Migoya is with us live.
Hi, Glenna. How are you?
Good morning. I'm great. Thank you. I wanted to sort of tell you how stunned I and my colleagues were listening to that statistic that you gave in the middle. Actually, it's right after on this press call, right after your own team and Dr. Lillian Abo literally did plead for people to get the vaccine. And so to find out that, understanding that not all Jackson workers are healthcare workers, you have a whole community of non-medical related people working there too, but 42% of unvaccinated there on the front line of the worst cases was pretty stunning. Explain that.
Well, since that time, Glenn, I would think that number is probably closer to 40. We've seen a lot of employees lately coming in there. I will also tell you that our doctors are 89% vaccinated. So the scientists understand the seriousness of this thing, and like I said in that press conference, our people are no different than anyone out there. They listen to rumors, and of course, because they're in a hospital, they even listen to more rumors. And the problem is that there's a lot of information out there, and all we're doing is continue to educate people. Since we've seen this extreme, highly infectious virus that's going on right now, we're seeing a lot more people starting to get vaccinated, and even our employees are doing that. But let me give you an example of this, because this is important. As of 3 o'clock this morning, we got the latest sequencing from Miami-Dade County. Our pathology Jackson team got these numbers from our latest sequencing. 49% of our variants are Delta variants in Miami-Dade County. Just 2 months ago, it was 2%. It's 49% today.
Wow.
The Brazilian variant is still 26%. And here's a real shocking thing. There's something called the Colombian variant, which the World Health Organization is looking at interestingly because it's spreading in Colombia quite a bit, and they haven't seen it anywhere outside of Colombia. Well, guess what? In the last week, 10% of our patients had the Colombian variant. Why? Because of the travel between Colombia and Miami. So Miami is a very different place that gets a lot of these variants in front of us. Luckily, the Pfizer and Moderna vaccine are still 95% effective. Remember that, 95% effective. So nothing is 100%.
Right. So let's put this into context for everyone watching, because those were some stunning numbers on the variants that you just delivered. So for a variant to develop and for COVID to spread, it needs hosts, what your doctors call the host, people to be infected. And people being infected are the unvaccinated. So does it stand to reason that by getting a vaccine, you're not only protecting yourself, but you're helping to end, just like polio or smallpox, the ability for COVID to spread and become these variants that now you're seeing explode?
Well, listen, without a doubt, that's what we've been saying all along for the last 6 months. The only way for viruses to spread, they need a body. They need a host. And without that host, it doesn't happen. The good news is we got 77% of all people in Miami-Dade County at least have one shot, and 68% have 2 shots already. That's great news. That still leaves 500,000 people in Miami-Dade County that are not vaccinated. We're seeing, not just in Jackson, but throughout the entire community in South Florida, 95% of all patients in hospitals that have COVID are not vaccinated. This has transformed into the pandemic of the unvaccinated. The best way to deal with that is vaccinating everyone. And I know it's really, really difficult because we try to do this all the time in educating people. But every extra person that we vaccinate is one better opportunity of reducing the spike that we got going on. Today, we've quadrupled the number of COVID patients at Jackson that we had 3 weeks ago. We went from 50 to 198 patients in only 3 weeks. The number keeps climbing. The only way we're going to get that slope to reduce and the length of the surge to come down is by people getting vaccinated. It's extremely important that we keep saying that. And I heard what you were saying before. I don't care what party affiliation you are. This is not a party issue. This is a science issue and a prevention issue.
Yeah.
Get vaccinated.
So let me just share with you that we were on Jackson's campus this week talking to some of the employees who were not vaccinated, and one of them, who worked in the engineering department, I had a whole conversation with, who said he just does not trust government. I actually put a little clip on my Twitter feed of that because I thought that was such an interesting statement. He doesn't trust government. That's the reason he's not being vaccinated. How do you get around that? How do you get around people like this engineer who
Well,
just will not?
but this is part of the misinformation. This vaccine was not created by the previous government administration or anything. It was created by scientists. And if you go to the history of this thing, how the RNA and how all this works, it was scientists predominantly around the world that created this vaccine, which is not like any other vaccine. All the vaccines in the history of the world are around animal-based vaccines. This is an RNA. This is a very different vaccine, and it has no relevance to all the side effects that you've seen with other vaccines, meaning specifically the Pfizer and the Moderna vaccine. And that's why these two have a much higher effectivity rate than any of the other vaccines. And when you say that government created this thing, that's a complete fallacy and misinformation. And that's why we, myself and you, Glenn, as part of the media, we really have a responsibility on continuing to educate people. And I thank you very much for doing this, and educating as many people as possible to understand this is not a government vaccine. This is the scientists coming up with the latest and unbelievable great situation that we have in front of us of being able to stop this virus this early.
We're trying for sure.
Thank you.
One more question for you, based on what we saw in the last very serious run-up when hospitals were so overwhelmed. Characterize how Jackson is doing and how the staff is holding up, and also is there any plan to maybe again forestall elective surgeries because of what you're seeing and the amount of work and rooms and resources that are being directed to COVID?
At this point, even though we've talked about the rate of increase, we're at 200 patients. Last year when we did this, we had 500 COVID positive patients. We're nowhere near to that level at this point in time. We hope we don't get to those levels. I still have a glimmer of hope that because we have such a high vaccination rate in Miami-Dade County, we have the largest, we have the highest vaccination rate in the entire state of Florida, by the way, that we will see this surge lose its fuel here pretty soon. I'm hoping. And if you look at any of the forecasts that we've got, is that this surge will last another 3 to 4 weeks. If that is the case, we should be able to prevent it. But the only way we get there, we can't just sit at home, is by getting vaccinated. I know that people are tired of this. We've been at this for a year and a half already. I'm tired of it. But and of course, we've had so many other informations. The Surfside problem that we had, unfortunately, the unfortunate problem, we had so many deaths. People were focused on that. They were focused on Cuba. They were focused on Haiti. And so people forget, that little thing called COVID. That little thing called COVID is still around and very much alive.
Yeah.
We got to get vaccinated.
Yeah, and we had reported on these new sites that opened. All of that is on our website. There's no way to not know as far as we're concerned. So Carlos Migoya, Jackson Health Systems, we always value your time and appreciate you being with us.
Thank you.